My name is Kim Foster, and joining me on the panel is Associate Professor Tony O'Brien, Dr. Toby Raeburn, and Peta Marks, and the four of us are editors of a new text on mental health in nursing, theory and practice for clinical settings. And today, here in the panel, what we'd like to discuss are some of the challenges that many of us who are educators face in the current environment in undergraduate education. And we're each going to talk to some of the strategies and approaches that we have developed to address some of those challenges. One of the things that I'm sure many of you will find can be challenging when you're actually teaching undergraduate students about mental health nursing is what is our approach, what's our framework for mental health nursing practice. And this is a very new model that we, the panel, have developed as part of our new text in the hope that we could try to help students understand a bit better what it is that mental health nurses do and the environment within which they practice.
The big change that we made with this text was to think about, we changed the title to Mental Health in Nursing with the subtitle Theory and Practice for Clinical Settings. And we did that because we realised that nurses in undergraduate programs need to have an understanding of mental health that they can apply in all of their clinical practice settings. So we know that there's a distinct body of specialist knowledge that nurses need to learn in their undergraduate programs. But we also know that in terms of applying that knowledge, the clinical settings that nurses are practicing in are often not mental health specialist settings. They're general nursing settings, primary care, acute medical and surgical, emergency department, and others. So we've provided some coverage of mental health issues in those non-specialist settings, but we've held on to the core of the previous text, which is to provide an outline of the specialist knowledge that nurses also need to learn in their undergraduate programs. So that's a big change in the direction of the text from the previous editions, and we needed, when we did that, to kind of pull that all together within an overall model, which is what the social ecological approach has done for us.
We've tried to move this book into its next iteration, and we certainly didn't want to throw the baby out with the bathwater, but we did in the beginning of this whole process, which was a good couple of years ago now. We did have sort of everything on the table, and we got to thinking about the value of history in mental health nursing textbooks, and we looked across the market, and we realised that several textbooks in nursing these days don't include any real reference to history. But we, as an editorial team, felt that history was important for some of the reasons that are there on your screen. So, I mean, one of the things that we did do, though, was move away from a discrete chapter on history in the textbook. So we've moved from having a chapter which had previously been chapter 3 in the old textbook about the foundations of mental health nursing, written by Katie Evans, which is a great chapter. We've moved to the use of historical anecdotes, which we've really peppered throughout the text. So a couple of historical anecdotes in each chapter. And our continued inclusion of history is based on our conviction that without knowledge and reflection on how theory and practice have contributed to and distorted past approaches to mental health care, nurses can't hope to understand the effect of the past on perceptions and experiences of patients, families and communities who they work with. And so we're trying to make history a bit more accessible, I guess, for nursing students, and to make it relevant to each chapter as we move through the text.
I'm going to be speaking to you very briefly about mental health in the context of clinical practice settings, and specifically in relation to section 3 of the new text. As editors, we felt it was really important to provide some examples of how these fundamental mental health nursing knowledge and skills can be applied in a range of common clinical settings, and also to talk about and describe the role that a specialist mental health nurse might take in a particular clinical setting. So we've included chapters in this section 3 that relate to primary and community care, emergency care, generalist inpatient medical settings, older age care, perinatal and infant mental health, forensic mental health, and then mental health settings more broadly. So you can see on the slide here some of the elements of the chapters. So the chapters in this section are quite different to other, quite a different format to other chapters in the text. Each of these chapters is written by clinicians and academics who've developed the chapter content around 2 common scenarios. So that's describing a typical presentation that they might encounter in their clinical setting. The scenario might focus on the mental health needs of a person with physical illness, which we know are often ignored and which impacts on physical and mental health outcomes. Or it might focus on the physical health needs of a person with mental illness. And of course, each of the chapters in the final section of the text still contains key points, key terms, learning objectives, and I think very importantly, not just in this section, but also overall, is the lived experience comment by Jared Hickmont, who is our colleague, lived experience colleague, who's highlighted in each of these chapters and in many others some of the key points that he wanted to make in relation to the chapter, in respect to the chapter, which to my mind really adds a strong relevance to the importance of the chapters and also should be the lens by which the reader approaches each chapter.